right, everybody. Thank you for waiting for me. I'm very busy, as you know. That's yours, and that's yours. Okay, everyone. So our first case today is a pretty standard one that I'm sure we've all seen lots before. Mr. Kelly is an 87-year-old man with metastatic prostate cancer. He is no longer receiving chemo, and he was admitted to oncology as a result. And as a result of the chemo, he's now suffering from anemia, with painful mets in his spine and his left hip. He is now on opioid therapy, but since starting that, he has been complaining of constipation.
So the biggest issue I have here is that I absolutely cannot communicate with this patient. I can't understand him over his accent, and to be honest, I mean, he's 87. I don't even know if he's in his right mind. It doesn't seem like he understands anything we talk to him. In the interest of time, I think it's so much easier to talk to his family since they're always there with him.
If he's that difficult to understand and isn't coherent enough to communicate with, it's quite possibly that he's senile and needs a psych evaluation. If all that goes as I expect, his family is likely going to have to be his substitute decision maker. Being as old as he is, there's definitely a chance that he's not even educated enough to make his own decisions anyways in the first place.
Yeah, and with respect to the constipation as a result of the opioids, it's noted in his chart, but his family's complaining that none of us are doing anything about it. But I mean, let's face it, constipation is somewhat to be expected, for an old guy going through this. We can probably just give him a laxative and see if that helps, but I think he has bigger problems to worry about right now than that.
Yeah. I mean, I could try and arrange a surgery consult, but at this point, I'm not very optimistic about being able to do anything. And with this man's age and his prognosis, I don't think he's going to be able to handle any more surgery anyways.
Yeah, I can take a look at him and see what he's able to do in the hospital. Maybe I can find some exercises to do to get him up and out of the bed. I mean, maybe help with his digestion. It might not be worth it, honestly. I mean, to make too many changes in his home or anything. He's already 87. At this rate, I'd be surprised if he makes it there.
Okay, well everyone, thanks for your input on the situation.